Hospitals in northern Idaho are now rationing health care because they have, well, too many COVID-19 patients to handle. Officials at Yakima Valley Memorial Hospital say they're not too far from needing to take those same drastic measures. Cap KVU's Emily Goodell spoke with the chief medical officer about what this means for patients and how close they are to having to make those life and death health decisions.
This is kind of a slow simmering mass casualty event.
Yakima Valley Memorial Hospital is currently at contingency capacity, the last step before moving to crisis standards of care.
What crisis standards would mean if we get there is that I don't have a place to send that patient. I don't have the oxygen. And that means somebody somewhere is going to get taken off oxygen and given pain medicines to kind of give them a peaceful death.
Hospital officials say they could reach that point soon if COVID cases continue to climb at the current rate.
Honestly, if we get another handful of patients that require ventilators and another 10 COVID admissions, this could happen really quickly.
Especially if patients who are getting turned away in northern Idaho start looking for health care west in Washington state.
They're going to go to Wenatchee, they're going to come here, they're going to go to Tri-Cities, and it's going to march across the state. That could push us over the edge.
State Department of Health officials told Cap KVU Tuesday that the decision to move to crisis standards of care will not be made at the state level, but at the point of care, meaning it will be up to each hospital to decide if and when to make that move.
We are getting more and more stressed with all of our resources across the board that it only takes one of those resources to break down. You find yourself in that position. And again, the message here, I've said it at every press conference I've ever done, mask up, get vaccinated. It's the only thing that's going to really kind of change the trajectory on this.
In Yakima, Emily Goodell, Cap KVU, local news.
Thank you so much, Emily. Quite the sobering message. The hospital is asking local doctors and clinics not to send people to the emergency room for COVID testing because they're already overwhelmed with upwards of 300 patients visiting the ER daily. Instead, people should go to community-based COVID testing sites at Yakima Valley College.